Nasal BOC. Clinical symptoms. Profuse nasal discharge, which may become mucopurulent and frequently tinged with fine streaks of blood emanating from minute hemorrhages produced by the hooks and spines of the larva, thickening of the nasal mucosa, impairment of respiration, paroxysms of sneezing accompany migrations of the larger larva. To avoid the fly's attempts at larval deposition, a sheep may run from place to place, keeping its nose close to the ground, and sneeze and stamp its feet or shake its head and gather in small groups facing the center.